You're sick, you're dizzy, you're nauseous, and your throat hurts. Something that we've all said before. You take an aspirin, you take some Pepto, and you suck on a cough drop. When none of those remedies seem to work, where do you seem to go? The doctor's office. The place that treats you well, hears you out, and helps you get better. But who is the person that calls you back? The one that weighs you, checks your pulse, your respiration rate, and your blood pressure? What about the one who asks you, what brings you in today? Or those annoying questions like, do you drink? Do you smoke? Do you do any drugs? It's not the doctor, is it? No, it's the nurse. Today I'm here to persuade you why being a nurse is so important. According to Webster, the definition of a nurse is the work of caring for the sick or injured or infirm. That is the cut and dry definition. There's so much more to being a nurse. They care for you, they listen to you, and they try to make you feel better. According to Deborah D'Avialo, sorry if I pronounced that wrong, she's a PhD, ACNP, ANP, and Associate Professor of Northeastern University's Bove College of Health Sciences School of Nursing. A nurse is an expert clinician, scientist, healer, health translator, communicator, teacher, guide, and family supporter, all of which are needed to ensure the health and wellness of individuals, families, and communities. Nurses work to promote health, prevent disease, and help patients cope with illness. According to Santa Monica College, nursing is a blend of science and technology with the art of caring and compassion. Nursing professionals provide preventative and restorative health care to patients in a variety of settings. Every day on the job, nurses use the science they learned in nursing school, and when employed, they take continuing education courses on a regular basis to keep up with the latest in the medical and nursing sciences. Nursing is a science that requires in-depth knowledge, skills, and understanding. Nursing deals not only with a person's biological needs, but their psychosocial needs and their cultural needs as well. Nurses work closely with doctors and other healthcare professionals and serve as advocates for patients and families. So, if you like math, if you like science, and a little bit of technology, then I definitely recommend nursing. Especially if you like to make people feel happy, loved, and you do anything that can make them feel better. One reason to become a nurse is the options are endless. There are so many different types of nurses. A few examples provided by the best schools are critical care nurses. A critical care nurse works in what many of us think is the ICU or the intensive care unit. However, many hospitals these days have ICUs that specialize in particular health problems, such as cardiac issues, neurological problems, and burns. There are medical surgical nurses working as an RN or registered nurse in a hospital or surgical setting providing care to patients. Okay, so maybe you don't like blood. Don't worry, they have jobs that you don't really have to deal with too much blood. One example is a clinical nurse specialist who are authorized to work with patients in a clinical setting. They are able to diagnose and treat patients who are suffering from one or more of the normal health problems that people go to the doctor for. They are also able to prescribe medicine. Then there's a diabetes nurse who may work on their own to provide patient education, including nutrition and fitness information. They also may work with an endocrinologist, who is just a doctor who specializes in disorders such as diabetes. Maybe none of these sound interesting to you. Maybe you like more of a public speaking type. Don't worry, there's a job for that one too. It's called a health policy nurse. Health policy nurses do not work with patients at a clinical level. Instead, they work at a societal level to create public policies that will lead to a healthier population. As you can see, there are so many different types of nursing jobs out there, from infants to geriatrics, and from emergency medicine to family practice, even from public speaking to informatics. The opportunities are endless with this career, and I definitely recommend it. Another reason, they are always in demand. If you ever need a job, this career field is the one that would give it to you. They hardly ever lay you off because of the nurses being so in demand. Written in Nurse Without Borders as one of the fastest growing occupations in the U.S., there are a great need in the nation and across the world to hire nurses than any other healthcare worker in the industry. The only thing that these positions have in common is a registered nursing degree, commonly known as an RN. Once your prerequisites have been met and you complete the 4-year program to achieve your bachelor's degree, you are free to turn in whichever direction you choose. However, you can have an associate's degree in registered nursing, but most hospitals prefer your BSN or your bachelor's. According to all nursing schools, registered nurses or RNs are required to have a minimum of an associate's degree, but bachelor's degree in nursing, also known as a BSN, are also available and can help an RN earn better pay. And we all know better pay is awesome. Today I have shown you why being a nurse is so important. I have shown you the many different types of nursing careers, along with telling you how long the schooling is, and I have informed you that they are growing and it is a vastly demanded career. So, again, if you like caring, if you like compassion, if you like math, science, and technology, then nursing is the one for you. Definitely go for it. Thank you.